Well, I guess Marilyn and I are the only ones here right now, so we'll start. Um, we will start by talking about the changes we're making at Elbowwoods in light of the weather change because winter's coming. As most of you know, we have been screening people outside. We have been screening people outside because we were trying to mitigate exposure by bringing people who possibly had coronavirus into the clinic. Because of staffing and weather, we're now not going to be screening at the front door anymore, so people will present to the clinic. We will check your temperature and then offer you a mask, and then we'll bring you back to the clinical area where you will be registered and then brought into a room. We are asking people who have symptoms consistent with coronavirus, who think they have coronavirus and want to be seen, definitely call before you come. Let us know what your symptoms are. We'll tell you when to come in and we'll meet you at the front door. If someone just wants a coronavirus test, again, we'd like you to call ahead and we will arrange to have that done without bringing you into the building. We're probably going to start this probably next week, and it's a kind of a trial run. We'll see how it works, and if we find people are having difficulties with this, we will readjust. But right now, we're just trying to keep everybody healthy and safe. Anything you want to add to that?
No, other than my changes to the open screen.
Yeah.
Good morning, this is Marilyn Yellowbird with Public Health Nursing. Thank you MHA for having us on and answering questions. We are going to be changing some of our open testing that we used to have behind the clinic outside. Those will continue through October. And then starting in November, we're going to be having them indoors. We're not sure yet. That's still looking for a place that we can have it, but once we find it, then that'll be our permanent place to test. We don't want to stop the open testing because we know that people have to have excuses to get back to work, and they want verification of work. They also want, if they're having a procedure, the hospitals and clinics are requiring that they have forms and verification that they've had their test. So we are going to try to continue that probably on Mondays, but we haven't exactly nailed down the place yet, but we will. It will be indoors after October. Testing over the winter and indoor testing, that's what we were talking about as well. We will be doing our flu clinics. We'll all be indoors. We'll have one drive up, but we will not be doing that as soon as the weather gets colder. We will have our community flu clinics indoors following COVID guidelines. Again, everybody's going to be 6 feet apart. Well, if you're a family, you can all come in together. But if you're not, well, we have everybody standing 6 feet apart and waiting to get their flu immunization. But we want to get as many people immunized as we possibly can. The flu immunization and the vaccination itself will help boost your immune system. It's not a COVID vaccine, but it will help your immune system. It will boost it, thus making you a little bit less open to getting any type of virus itself. We're not saying it's going to cure the COVID virus, but we're telling you that it helps you so that you won't become sick from any type of virus. Okay, that's it.
When we do the open testing, when we do the mass community testing screens starting in the winter, they will be indoors, and we will use the same guidelines that we are using for the flu clinic. So we will have people try to social distance 6 feet apart, wear your mask when you come into the building. We're trying to find spaces that allow us to have kind of one-way traffic. You come in one door, you go out the other door, and still make it as efficient as the drive-up testing events that we've done over the summer months. We are not quite sure yet. A few of the segments we know where we're going to be, but other segments we're still not sure. We're still evaluating sites. And as soon as we know those, we'll let everybody know where you can come and be tested and what those dates are going to be.
Okay, so testing results, COVID results. One of the things we want to make sure that people understand that no news is good news. We get a lot of people calling the office requesting maybe a week later. If you haven't heard from anybody within a week, that means that you're negative. All positive tests are given out within 24 hours of the test. We are notified probably the next day at least, and then we call you. They'll call you, or Dr. Martin will call you. So no news is good news. Please, we've gotten stacks of paper that with negative tests that we were calling back, and we've spent mornings at our office calling phone numbers that were no voicemail set up, voicemail not available, voicemail full, and we would call back again at least 2 to 3 times. We can't continue to do that with this many tests that we're doing. We're going to give one call and that's it, but just realize that if you haven't got a result back, give us a call. We'll do the best we can to give you your results. Again, if you're positive, you're gonna get a notice within 24 hours at least.
Well, not necessarily within 24 hours. You get notified as soon as I'm notified. So as soon as I'm notified, I call people. Depending on the time of the day, I get the notification because people call me at 2 o'clock in the morning. I don't call people at 2 o'clock in the morning. I'll wait and call you later in the morning. But with the state doing more and more testing, we're not getting results back within 24 hours every time. Sometimes it's 24 hours, sometimes it's within 72. So give us a 24 to 72 hour range to call you. And I'm thinking most people who went to the last Newtown screening are wondering about their results. The state has increased their testing, and so they were trying to find alternate sites at other state labs to run the test. And so the Newtown last community testing was sent to North Carolina, and we have not received all those results back yet. And that's a delay from that testing, so that's why people have not heard.
Okay, thank you, Dr. Martin, for that correction. Another thing we want you guys to really understand is when you want to do these COVID tests, we don't ask for these tests. The tests are given to us from the state. They are issued by the state of North Dakota, which covers the whole state of North Dakota. We are making sure that the reservation itself is covered. That's what our job is. So we are doled out so many tests for each segment, bearing in mind that this segment it's an open test. So that doesn't mean that just the Native American people or are there for the test. The tests are open to the public. So even when we get the responses and we get the test results back, it doesn't necessarily mean if we get 10 positives in the East segment, that doesn't mean East segment has 10 positive Native people. It could be anybody that could have tested positive. Bear that in mind. Get to the testing early. If we have 200 tests and we're there from 2:30 to 4:30, we probably will run out if there's a lot of people there. Don't wait till the very end. And unfortunately, we've had some problems with that. We apologize from the bottom of our hearts that we have to turn people away because that's not what we're there for. We're there to get people tested. But you got to get there early. It's first come, first serve. We request so many tests for so many people in the segments, but they can only issue us as many as available to the state.
And that's one of the questions we keep being asked is how many positive people are in each segment. When people come to the mass testing, they come from all over the reservation. So if you do get 10 positive in each segment, doesn't mean that the 10 positive people live in the east segment. So it's impossible for us to tell you what segment people, how many are positive in a segment, and also because I really don't know addresses. I just know numbers and names.
Okay, so that being kept in mind, making sure that you guys get to the test early. We're doing the best we can to get everybody tested as much as we can, as much as possible. Elbowoods will continue their open testing on Mondays, or if Monday is a holiday, we'll try to do it on Tuesday. Again, the test will be available from starting at 9 till when we run out. So if we start at 9 o'clock and we run out by 11 o'clock, then that we're done, because they can only handle so much in our little lab as well. What can you do to help COVID?
Can we do one more thing
Yeah.
about that?
Okay, hang on.
Okay. Hi, this is Dr. Marty again. Just one more update on the testing. The majority of the testing that we're doing now is being sent to the state. As most of people know, that there is concerns about false negative results from the rapid testing. And so with that in mind, the Abbott ID Now machines, which are rapid testing machines that we use at Elbowoods, the company has changed their information of use, which means we have to run the test within an hour of collecting. So before we were able to do multiple, now we have an hour to run a test. So we're only recommending that people who have symptoms get the rapid test. And people who do not have symptoms are usually going to be given the state test. And then we have to wait for the results to come from the state. The only other thing I want to say about that, if you are positive, you do not need to retest. You do not need a negative test to go back to work. The state will tell you when your isolation is up, and usually that's 10 days after the onset of symptoms, or 10 days from the date you test if you don't have symptoms. It's no longer recommended that you get retested. They're not even recommending that healthcare workers get retested. So once the state says your isolation is up, you are free to go. We think you are no longer contagious or infectious, so you should be able to go back to work, go back to your daily activities, although we still recommend that you wear a mask.
Just to bearing that in mind, then for all the employers, that is the case. That the reason why we're making this point is because medically speaking, that person that tests positive, they can test even when their quarantine is up, the virus is starting to die within their body. But that if you do take a test, it will show up as a positive on that test. So you could technically, people have been positive for at least 2 to 3 weeks after they're not contagious anymore. So really, that getting a test to get back to work after you've been positive is kind of moot at this point. If you're no longer contagious, you are no longer contagious. That being said, with all the testing, we really would like to really stress our public health aspect. And you're talking to a public health nurse, so that's what I'm going to push. You can stay safe by wearing a mask. I can't emphasize this enough. People need to start wearing masks. We need to stop getting together in huge crowds. Smaller crowds are better. I understand the cultural aspect. I am from the reservation, but we need to stop with huge gatherings. That only mitigates that virus. That only causes the virus that could be transferred from person to person. Wearing a mask is your best bet. Using hand washing. This is not a political statement by any means. We're just saying that the best thing you can do to help yourself and help your family stay safe is to wear a mask. Outdoors, when you go to the stores, when you go anywhere, having that little bit of sanitary hand wash to use if you're not able to wash your hands. That's the best thing for you. Working in your workspace, at least once or twice a week. When I go into my office, I wipe down my computer. I wipe down my phone. I wipe down especially the door handles, the things that people could touch when they come into my office. I wipe down the chairs in my office and the things that other people sit in. At least once or twice a week, I do that. That keeps you, that keeps your office safe. For the many people that gather, that have 2 or 3 people in their offices, can't stress enough again, you guys should be wearing masks. I can give a really good example of that. There were 2 tribal programs that did where each one of the employees tested positive. The one program, nobody wore masks, and 2 to 3 other people tested positive within that area. The next program, somebody did test positive, but that program all wore masks, all washed their hands, used hand sanitizer. Nobody tested positive after that. That is a tried and true example of the reason why people should be wearing masks. And it's a simple thing to do. It's very easy. You can do it. You can have your family do it and your coworkers do it. Well, um, Dr. Martin can tell me to talk about the home safety.
Okay, I know, thank you. Um, the thing I was going to also say is that what we know about this virus is a lot of people have symptoms, and you can have symptoms of a cold, symptoms that look like the flu, symptoms that look like allergies, to no symptoms at all. And so you cannot tell who has this virus and who has not. So that's why we strongly recommend that people wear their mask and do good hand washing or using hand sanitizer, and do the 6 feet distance. We at home, the thing we recommend is exactly the same thing we recommend at work, that you wipe down surfaces, that you limit the number of people who are non-family members who are in your home, and if you have to be around other people, that you wear a mask when you're around them, that you don't attend large gatherings. At this point, we're thinking 10 people, because 10 people can social distance. Larger groups than that, you're all packed together. And then home, taking care of your home is just like taking care of your workspace. There's not very much difference in that. Just good sanitation, and as much as possible, staying away from other people, or limited your exposure to other people. Are we talking about the quarantine cleaning?
Yeah. I'll go over a little bit about what happens when you test positive in your home. And you have the one person that tests positive, that person will be asked to isolate, and the home itself will be in quarantine. So there's a difference between isolation and quarantining. And there's been some, it's understandable to not really know the difference between that, but there is a difference. Isolation is that person is going to be by themselves, hopefully in a room by themselves. We're asking them to have as little possible family contact as possible. We understand being in a home that's not easy because you're with your family members. You may have small children, but if you are out getting out there and talking to other of the family members, to please wear a mask. Simple as that. You can get out, you can talk to other people, just wear a mask. The house itself will remain in quarantine. So the rest of the family people will not go out. You won't have anybody come in. Nobody out, nobody in. That's the big rule. Limited people to come and visit you. I know that that's our cultural way, and I know that's our people's way to go visit the sick people, to take food to somebody who's in quarantine and stuff. And there's nothing wrong with that. We're not saying to stop that. We are saying that the food, or if you bring it over, you can talk to them through the screen window. You can bring food over, leave it on the porch, things like that. There's nothing wrong with that. I'm more than happy to see people doing that. In your home, for those of you that don't have the dishwashers and do dishwashing this old-fashioned way, the way we used to do it, I just put a little bit of Clorox in the dishwater, wash all the dishes in Clorox, and then you're going to wipe off all the handles in the door handles, in the home. That means the things that the people use the most. Wipe your stove door handle down, your stove door knob, your stove knobs down, your refrigerator handle. All your door handles in the house need to be wiped down. That is the best way to keep that virus from multiplying and to keep the rest of your family safe. If you are in isolation, we ask that you use paper plates and cups in the room and just eat in the room. No family dinners. Most people don't really do that anymore. Everybody sits and watches TV. But the person that's in isolation probably should stay in their room. We get rid of have your own garbage bag in the room so that you can throw your dishes away there. That'll be for 10 days. And then you can come out and the state will probably notify you that you're off isolation. That does not mean in any way that the house is done with quarantine. The house remains in quarantine for the 14 days. So the more that you clean your house, the more that you wipe things down, the better it is for your family. Because if somebody does come up positive again, that household starts from that day again. So you could start another 14 days from the day your family or other family member tests positive. Do you have anything else?
Yeah, I wanted to talk about the difference between isolation and quarantining too. When someone is in isolation, that is 10 days from the onset of symptoms. So if you have symptoms starting on Tuesday, you're isolated for 10 days starting Wednesday. So it's 10 days from the date your symptoms started. If you don't have any symptoms, then your 10 days starts from the day after your positive test. And so that's isolation. People are isolated when they are positive. The rest of their contacts are put into quarantine. And you are quarantined for 14 days from your last exposure to someone who is positive. So if it's a coworker and you were exposed on Tuesday, then you are in quarantine for 14 days starting on Wednesday. But if you live with that person and you are constantly quarantined, your 14 days doesn't officially start until their last day of isolation. So that means the household can be in quarantine for up to 24 days. So I think people are getting confused about the numbers of 10 versus 14. That's the difference. So 14 is kind of the average number from the last contact, but that's from the last contact. So that's why households have been in quarantine for months. So don't be surprised that it goes longer. And it's not just for the positive person, it's just not a numbers game. There are also other things that have to happen. If you have symptoms, your symptoms have to be improving. If you have fever, you have to be without fever for 24 hours off all medication. So it can actually go longer than 10 days too. Okay. And then we talked about taking care of your house.
Yeah, you're fine.
Taking care of your household if you have asthma or respiratory problems. You can still clean. We know that bleach is a really good cleaning agent for this virus. It will definitely kill the virus. And if you have asthma, you're sensitive to chemicals, the only thing that I can recommend is you can have someone else do the cleaning where you're kind of isolate yourself away. Or I have asthma, so if I have to clean with bleach, then what I do is I wear a mask. I dilute the bleach in water, and then I still use it, and then I remove myself from that particular site. So we still recommend using bleach even if you have respiratory symptoms.
Again, what Dr. Martin was saying, that yes, it's really important that you do the cleaning, especially in your home. The virus itself is easily killed by bleach. It's not a hardy virus, but the reason why it's developing so fast is because people are not wearing masks. People are the ones that are spreading it. So that's the reason why it's a pandemic in this area. The fact that people are asymptomatic and still shed the virus is another reason. The fact that people are supposed to be in quarantine and they do not remain in quarantine. They go ahead and go out and they don't really believe that they're going to be bothering anybody because they're not really sick. That's another reason why our numbers are increasing. So again, if you are in quarantine, please stay in quarantine. We shouldn't have to follow you guys around. Um, so we can talk about the flu. I'd like to talk about flu shots for a bit here. The flu shots are being offered now over in all the segments. We've sent out flyers. I believe the KMHA radio station will announce every single day when we do have a flu clinic going on. We are starting our flu clinics in October because the vaccine itself needs to have 3 months to peak. So if we get it in October, we're hoping that it peaks in January, and that's when our flu season is going to be at its worst. We're going to also be dealing with COVID as well. So again, flu shots are only going to help at this point. Getting the flu shots is absolutely good for this winter. That's what we need to remember. There really isn't a lot of difference. One of the questions was, what's the difference between flu shots, flu symptoms, and COVID symptoms? It's not a lot. COVID symptoms are geared more towards respiratory and fever. You're going to have more of a headache and probably probably less, you know, like sniffling and things like that. But again, you could be looking at a flu for the same thing. One of the things, the key points for the COVID is the loss of taste and smell. If you have lost your taste, you can't smell, and we've talked to many people. It's a definite. Some people have walked into smoke, couldn't tell the difference. People have actually taken their spouses actually taken perfume and sprayed it in their face, and they said I couldn't smell a thing. And they were asymptomatic. They didn't have any. They weren't sick. They didn't feel bad, but they had they lost the sense of taste and smell. So remember that when you guys are talking about your symptoms, or you're thinking about your symptoms. That's one of the things that you want to watch for. That's a key sign for COVID, is that loss of sense of taste and smell. Dr. Martin, do you have anything to add?
The only thing that I would also add is that how to tell between flu, cold, allergies, COVID, you're not going to be able to. Basically, the symptoms are basically the same. The loss of taste and smell does seem to be a hallmark of coronavirus, but other than that, any other symptom that you have with any of those others could be coronavirus too. So we are seeing a lot of people who are coming in who are positive said, oh, it's just my allergies. Well, it wasn't just their allergies. So that's why we're definitely recommending that you treat every symptom as if you have coronavirus, and that you wear your mask and you isolate. Or you not isolate, but you at least stay away from other people. And if you're concerned, especially if you have fever, cough, loss of taste and smell, definitely we recommend that you get tested. The big thing about coronavirus is the hallmark is the respiratory symptoms. So if you have shortness of breath, difficulty breathing, you definitely need to be evaluated. And if it's so severe, then you need to go to the emergency room. That is what most people are being hospitalized for, is severe respiratory distress. And that is also what most people are dying from, respiratory failure. So do not ignore those symptoms. Don't think that it will get better. You need to be evaluated.
Other than that, we again would like you to make sure and get your flu shots. They're all available. We are out of the 65 and over high dose. We're expecting it. Alba Woods is expecting that this week. So we are going to be having our next flu clinic. Will be at the Terrell building from 1 o'clock till 4. And we will have the high dose at that time. And that will be for any elders 65 and over. We are expressly hoping that elders who are compromised with diabetes any type of respiratory problem, any type of high blood pressure, anything like that, that you guys make sure and come in and get that high dose flu vaccine.
This is our normal flu and cold season. We have already been notified of at least one person who already has the flu. So definitely, if you're going to, we recommend that you get your flu vaccine. It takes at least 2 weeks before the flu vaccine becomes effective. So if you get your flu vaccine today and you get the flu, it's not from the vaccine. It's just you are exposed and your body is now reacting to the flu. So still, we strongly recommend, especially during this season with coronavirus added in, that everyone gets their flu vaccine. Okay. Then it was asked when and where to get oxygen monitors. People who are having shortness of breath, who are concerned that their oxygen levels may be low, and are enrolled members are seen at the clinic, we can provide pulse ox to them. You can also buy them off Amazon if you just want one at home. But we don't want you to get a false sense of security because you have an oxygen monitor, that if you just monitored your oxygen level, that you are fine. If you're having difficulty breathing, you need to be seen. Please don't set on it, because we have had people who are watching their oxygen levels drop into the 80s and saying, oh, okay, I'm fine. No, you're not fine. You definitely need to be evaluated. So please always call in. Your providers are available. The nurses are available. Anyone can help you make the decision whether or not you need to come into the office or if you need to go to the emergency room. And we are there for that. And then one of the questions we had was whether or not our contracted health services put a priority on COVID patients, inpatient care, and yes, it does. And I think we've talked about the asymptomatic COVID patient. Okay. All right.
Any questions?
Okay. So if there's anybody out there listening and has any questions for Dr. Anita Martin or Marilyn Yellowbird, feel free to call in now. We'll stay on for a couple minutes. If you have any questions, 701-627-5363 is the number. While we wait for some callers, we'll just kind of go over those flu shot clinics that they had mentioned. So today there is a flu shot clinic going on in White Shield at the White Shield Clinic from 9 a.m. to 4 p.m. If you're going to be in the area, if you're in White Shield yourself, make sure you go get yourself, your family, the flu shot. And then on October 16th, like Marilyn Yellowbird was mentioning, at the Tarot building, they will be having flu shot clinic from 1 to 4 p.m. And then on October 22nd will be partial Red Hall. That will be from 4 to 6 p.m. on October 22nd. And then Four Bears Casino will be having a flu shot clinic on October 27th, 3:30 p.m. to 6 p.m. And finally, on Twin Buttes on October 29th, from 4 to 6 p.m., there will be another flu shot clinic. October is also Breast Cancer Awareness Month, so Lila Wales will have her breast cancer awareness booth, along with sign-ups for mammograms at the flu shot clinics. Make sure you guys bring a mask, social distancing, practice that. So yeah, if you're in White Shield today, if you live in White Shield, make sure you tell your friends and family to go get a flu shot. Okay, Mitch.
Yeah, the marquee sign in White Shield says the flu shot's canceled.
Okay.
So you might want to let them know.
Okay. Thank
Okay,
you.
thank you.
We weren't sure if it was or not, so.
Okay, so White Shield is canceled?
We don't know yet. Yeah, just say it. We don't.
Okay. I guess as of right now, White Shield is not going on, so scratch that. However, October 16th, which is in 2 days on Friday, they will be having a flu shot clinic here at the Tarot building from 1 to 4 p.m. So they will be having that high dose for the elders. So if nobody has any questions, thank you guys for coming in today and addressing concerns and some questions the public had. A lot of stuff that I was